will let you know that this is going to be a live session and it will be recorded. This information is of value for participants that cannot be with us here live and for future purposes. Before we start, I also want to advise that there will be time for questions after the session, and it'll be about 5 to 10 minutes. It is now my pleasure to introduce you to our first session of the conference, the opening keynotes panel. This panel has Cara MACINNIS, Marcelo MARTINEZ, Gilles LEBLANC, Tracy SLANEY, and our facilitator for this one is going to be Dr. Septa Stavis. Take it away, Septa.
Thank you, Jennifer. Can you hear me well? Can you hear me? Okay.
Yes,
So, hi, Marcelo.
Hello.
So I'll ask the tech personnel to show myself, Marcelo, Cara MACINNIS, Tracy SLANEY, and Gilles LEBLANC, all on the monitor, please.
Marcelo.
Hi, Marcelo.
Hi.
Good to see you. Yes, we are happy to have you here. All right. So
Septap, when the people speak, they'll pop onto the screen. That's what's going to happen.
oh, that's what's
During
going
this.
to happen. Okay.
Yeah. So you won't all be a panel in that sense, but you will all be seen when you speak.
Okay, I got you. Okay, we have a couple of minutes, so Marcelo, we can see and hear you. How about Cara, Jill? Do you want to say just hi?
Hello, good morning.
Hi, Jill. Hi. How about Cara?
Hi, can you hear me?
Yes, we can. So nice to see you. Tracy SLANEY, my friend, are you there?
We're here.
You are here. Okay, did I miss anyone? No, I think we are okay. We just have one more minute. We will wait and start on time. But I just want to say quickly how excited we all are today. So thanks for everyone joining us this morning and throughout the day. Certainly, Jen, you are an amazing moderator. I really particularly thank you for that as well. So, folks, this session this is the opening keynotes because our conference is, about humanizing precision medicine in Atlantic Canada. That means we need to put patients and families at the center of everything we do. So, with this spirit, I think it's just not extraordinary that we have the opening keynote by our patient and family members today. So, I welcome everyone. Cara, Marcelo, Gilles, and Tracy. I know you all well, but I think we will start with maybe briefly introducing yourself, starting with Marcelo.
I'm Marcelo Martinez. I live in Charlottetown, PEI. I would say that I am a survivor so far. I experienced cancer on my own, and this is my way to a good opportunity to share with others my journey.
Thank you, Marcelo. Next is Cara. Hi, Cara.
Hi, good morning. I'm Cara MACINNIS. I am in Nova Scotia. I'm in Wolfville right now. I live in the Annapolis Valley. I started my cancer journey in Alberta, but I moved to Nova Scotia while I was still in treatment, and I'm born and raised in Nova Scotia, so I came back home. I was diagnosed in 2020 with triple negative breast cancer. I did various forms of treatment, including chemo, multiple surgeries, radiation, antibody therapy, all of which took 22 months. So it was a long time. My status now is no evidence of disease, which is great. So yes, like Marcelo, I can call myself a survivor too, which is nice, but also it comes with its own anxieties. I've been getting quite involved with cancer advocacy and doing some work through my own work with cancer. I'm a professor of psychology, and cancer has kind of snuck its way into my work, but also into my volunteer time as well, which is kind of a coping mechanism for me, I think. But it's working thus far. So I'm happy to be here today to share my experience with you.
Thank you, Cara. Hi, Gilles.
Hi, my name is Gilles LeBlanc. Bonjour tout le monde. I am from New Brunswick. My journey with cancer started in 2022 when I was diagnosed with prostate cancer. That I had I say this guiltily sometimes, an easy time of it. Everything went well, and to date, everything is still going well. And as to my advocacy, I think I did most of it prior to having cancer. I was on the board of directors and chair of the board of the Atlantic Cancer Research Institute for 8 years. And I participated in a lot of fundraising. So that has been my advocacy since then. Participation in ACPAC has been my advocacy. Thank you.
Thank you, Gilles. And Tracy.
As usual, I think I have the most to say. Sorry. My name is Tracy SLANEY, and I'm from a small rural community in Newfoundland. I'm a mom, a spouse, a fisheries officer, and a caregiver. My experience with cancer is what brings me here today. That's still a hard word for me to say because it's yet another stark reminder of where I've been and where my family is now. But then I also remember to think about how far we have come. You see, we are in our 4th year of treatment of colorectal cancer. My spouse has endured, or should I say flourished, in spite of completing 156 chemotherapy treatments. That's quite a lot to be proud of in and of itself. But at the beginning, and that would be April of 2020, right at the start of the national COVID shutdown. To make a long story short, many symptoms were overlooked for a long time until March 29th, 2020, when my husband Jim was admitted and rushed to surgery for a complete bowel obstruction. The obstruction turned out to be malignant, and the worries of the pandemic were all but forgotten as hurricane cancer entered our lives yet again. As for my advocacy efforts, I'm currently the provincial ambassador for Colorectal Cancer Canada. I'm also an athlete with the Canadian Cancer Society and a member of Newfoundland's public interest group on cancer. But I have to say, it wasn't always like this for me, because for the first 4 years of my husband's battle, I was so overwhelmed with cancer that my inner voice was stifled. But then I eventually rediscovered myself and my advocacy. And I discovered that it can play a role in improving the current cancer patients and for those that will follow our path in the future. I knew being silent was no longer an option, so it was now or never, and I began to speak about testing, financial, emotional, and the physical toils that cancer has on a family. I needed to turn one of the worst experiences of my life into something positive. To know that you might be instrumental in saving a life simply by completing a walk, a pledge sheet, or disseminating information, for me, is euphoric, because you already know the hardships of a stage 4 diagnosis.
Thank you very much, Tracy. Folks, thank you. It's such a pleasure to be with you today and get to know you a little bit better. You are wonderful, and we are really looking forward to your stories and insight, because I think they are going to help us see the world from the lenses of people that are affected by cancer, either as a cancer patient survivor or as a caregiver to a cancer patient. This session is being recorded. I forgot to mention at the beginning, and you don't have to say anything you are not comfortable of saying. And I also would like to remind the participants that please be mindful of the privacy of yourself and others while engaging with us, for example, in the chat box. Okay, so I think we have a great representation of Atlantic region survivors and or people affected by cancer as well as their caregivers. So the first topic we want to talk about is about precision medicine. So starting with Marcelo. Marcelo, can you tell us in your own words what you know about precision medicine in cancer and provide any thoughts you may have on it? Cancer and precision medicine. Yeah.
Yeah. Well, in my own words, I have to use some of the words I've read as well. For me, precision medicine focus in cancer is customizing the treatments and cancer care based on an individual's DNA or genes, the lifestyle and the environment in which that individual lives. Based on that, then you can have a plan for treatment and for care, taking care of from a holistic point of view instead of the traditional one size fit all type of treatment. I think that's one of the main issues, and by understanding the patient's genome, even mutations or silent genes, the researchers can also develop new methods of treatment and utilize much more the genetics, and basically we can have a better efficacy with less side effects of a drug, for example, in chemotherapy, for example. I think that some challenges still remain in terms of, and what is especially to me is the information coming out of the genome analysis, mainly because nowadays data security is becoming very important, and if you have your DNA sequences stored at some place, you want to make sure that that information is well taken care of. I wouldn't like to see that in a insurance company, for example, or in a private company. And I mentioned this because last week I received an email within the company I work for promoting the sequencing of your DNA for just regular treatments, for allergies or for diabetes and other treatments, common treatments that are given, and that the work is through a company in Ontario. And when I went to the website, I saw five Canadian insurance companies sponsoring that private company. So I wouldn't like to just let a private company managing my DNA. However, in the way that the networks in Canada, led by our scientists and government organization, are working, I think that's the way to go, and I wouldn't be opposed to that. But I would like to see my DNA information owned by a private company. That's for sure. Sorry, it took a little bit too long, but yeah.
No, that's good. I think it's a great point you are raising today. That's wonderful. So we will move on to the next one. Cara, Cara, do you have anything to say about precision medicine and cancer? Any thoughts?
Yeah, my understanding of it is very similar to what Marcelo just said, and I hadn't really thought about the data privacy stuff, but that is a really good point. For me, like, I feel very positively toward it. Like, it seems like a very good thing that it's kind of like personalized medicine, like, personalized to your disease and personalized to you as an individual. At least that is my understanding of it, which sounds very good. Like, I mean, of course, I think hopefully maybe this is the reason why we are seeing like some change in some of the statistics as far as some cancers go. So yeah, overall, like, I think it's a really important advancement, and I feel very positively toward it. My only reservation about it, I think, is that my general approach to cancer was that, like, I want everything. I want every treatment. I want the most aggressive treatment. I don't care how sick it makes me. I want it. And I know that's not everybody's, but that was how it was for me, because I've just my life situation. I felt like I don't have any other options but to get through this. And I would be worried, I think, with some of like the testing that, like, okay, what if I have, a genetic test and it comes back that like my tumor is like less likely or unlikely to respond to the standard chemo or one of the really good chemos. I would feel distressed by that. And I mean, that's probably like more psychological distress that needs to be felt with, but I would be like, oh, like, maybe we should just try it anyway, even if it's unlikely to work. So that would be my only reservations that I have about it, is that I know that those feelings could potentially pop up for people. But otherwise, I feel very positive and hopeful about it.
Thank you, Cara. And you also made a good point about our conference today, that the cancer is personal. So everyone will have different preferences, needs, or experiences and perspectives. Thank you for sharing your thoughts about precision medicine. I'm going to move to the next panelist, Gilles, if you would like to share your thoughts about precision medicine and cancer.
Well, without repeating everything that both previous speakers have said, I see it as custom designing a program for you. I am certainly in favor of that, because from the little I do know, I believe that attacking a cancer specific to me has to be advantageous, as opposed to using a one-size-fits-all scenario. So the science of today is complex. The science of today is going in the direction of precision medicine. I believe that it's going in the right direction.
All right. Thank you, Gilles. I think that's again very meaningful. So thank you for sharing your thoughts. I think you finished, right? Did you finish?
Yep.
Yes, thank you. All right. So we are going to go to Tracy SLANEY. Hi, Tracy. Do you want to tell us? Yeah.
I wanted to say, first of all, that I'm all for precision medicine, because when I said earlier that cancer had entered our lives for the second time, it's because my dad was actually diagnosed with diffuse gastric cancer. And a mere 31 days later, he passed away because there was no treatments available. And 6 to 7 months later, we learned the presence of the CDH1 gene in our family's genetic tree. So my interest is more than a little selfish, I have to say. And in our current battle now, we carry a rare mutation, genetic mutation. So precision medicine is what we actually need to survive, because the current chemotherapies that we are on do not target this mutation, and the prognosis is generally poor for our families. We, for some unknown reason, have managed to keep our cancer stable with the traditional chemotherapies, and many oncologists have wondered, what makes my husband so different? He is not supposed to respond, let alone be 1 year away from a 5-year diagnosis. So precision medicine would give us those answers. It could possibly help other families that are starting the battle. Unfortunately for us, it was explained that in order to have further genomic testing or anything else run, our current healthcare system, we would have to pay out of pocket, and the costs were exorbitant. So for me, precision medicine would actually mean that my kids would have their dad stay with them, and maybe the CDH one, maybe we could do a little better on that front too, because right now we have very little offer. So, my thoughts.
All right, thank you, folks. I believe you each shared valuable perspectives and thoughts and asked really good questions that will help the participants to think about precision medicine and cancer and learn about it more. So thank you again. So let's talk about the needs of patients and families affected by cancer. I'm pretty sure, cancer is a very challenging disease. So I'm pretty sure there are needs, priorities just caused by a diagnosis or treatment of cancer. So starting with Marcelo again, within Atlantic Canada context, Marcelo, what would be the primary needs of families affected by cancer, for example? It doesn't have to be your experience. It may be what you observed in your community.
Yeah, well, I think sometimes when we deal with cancer patients and even their families, the whole environment, we, like happens everywhere, we face a quite complex journey, and I think what we need is support, and then we have to give name to that support. But I think one of the most important things, at least in my experience, and just by chatting with other people, I think the guidance, especially at the beginning of the journey, as well as navigation through the system, or as we do in the Atlantic provinces, through the systems, because we have to deal with different provincial systems. In my case, was I had to go from PI to Nova Scotia to get surgery for the surgical removal of the tumor. I think that having somebody that can guide you through the process will be great, because we have lots of booklets and brochures that are excellent information. We also get a seminar type of just at the beginning of radiotherapy and chemotherapy, but that's to everybody. It's not personalized. So bringing the precision medicine in, I think that personalized guidance is probably one of the factors, or one of the needs that we have to check, because there will be people that don't. I was lucky to have a family, but there will be people that might not have a family around, might not have the resources to do it, and if they had to travel from province to province, that will also make it even more difficult for those people. So I think having somebody that can guide them and navigate through the whole process will be great. That's my take on this.
Wonderful point, Marcelo. Thank you very much. Yes, absolutely. So how about Cara? Cara, what do you think about maybe most pressing needs, priorities of patients and families in Atlantic? And again, it doesn't have to be your own experience, but it might be something you observe in other or within your community.
Yeah, I was thinking, I think about this question along the same lines as what Marcel was just saying, and I really love that idea of like taking a personalized approach to support and whatnot. And I think maybe what you're talking about a little bit is education. I think like more education is needed, and you're right that there are a lot of pamphlets and booklets, and those are great. but it's not necessarily enough, and that's not necessarily the best format for people to learn in, especially when they are overwhelmed by information. I know that they have like the chemo classes and whatnot, and for me that was online. And when I got to my first chemo, and I had watched the thing, and they were very surprised by it. They're like, "Oh, you watched it?" Because like nobody had been watching it, because it is complicated. It's complex stuff. And their experience was that not a lot of people had done that. So that suggests that, you know, there's a problem there, that maybe we need to be delivering it in a different way. And actually, I'm aware in Nova Scotia that there are some researchers who are working on this, like more like educational classes for those that are newly diagnosed with cancer, which is great. I don't know about other provinces, but I think people are working on it, which is good news. But yeah, I think education is really important. And then the other big thing for me is psychosocial support. I don't know if we're talking about that in the next question. I can save that if you want.
All right, wonderful. Thank you so much again. Absolutely crucial points. Gilles, with this, I'll move to you. Did you have anything to add to what Marcelo and Cara say?
Yes, a bit. I think information and disseminating the information becomes a very important component. I think for most people, once they get over the shock, they want to know what is going to happen. But a lot of people, you give them. I have a friend who received information in writing, and he simply could not understand it. I think the role of navigators that we have in New Brunswick is extremely important because of that. They can be very helpful. But I think we have more resources. Going back to what Cara said, education. The other element is access. Fortunately for my treatments, I was 15 minutes away from the hospital. So hop in the car, I went back home. But in the more rural areas where they have to come, I mean, New Brunswick, they have to come to Moncton. It is extremely difficult. Sometimes they have to be there for 5, 6, 8 weeks. There is a hostel that was built next to the hospital. That is a big help, but that is a real hardship. So that brings us back to the financial aspect of things. People do suffer hardships if they are in rural areas. A lot of the treatments easily they have to move to the urban centers to get it. So yeah. I think that's another element that we have to look at.
Yeah, absolutely wonderful point, Gilles. Thank you very much. We are hearing really amazing points here, and I'm really very excited to hear more. So Tracy, how about you? What would you think about the most pressing needs, priorities of the families in Atlantic Canada, or where you are in your community and so on?
I think many that are not immersed in world cancer don't understand the associated hardships that come with it. Many think that all costs are covered by our country's universal healthcare system. However, that's not the case. My family alone has accrued over $60,000 of debt in this 5-year battle. Prescriptions that are not covered, colostomy supplies that are not covered, travel that are not covered. And the emotional devastation was equally as harsh because my children were 16 and 8 at the time of diagnosis. In both cases, it was a life-defining moment. It was the moment we became that family. We were no longer an ordinary family. In the beginning, we also had support coming from every direction. But now we're part of another startling statistic, most commonly known as cancer ghosting. Those people have disappeared. We lost lifelong friends, even some family members, because they just couldn't cope, and they couldn't cope with the duration of the battle, and they distanced themselves from us, but we also made some amazing new connections that I'm sure would support us until the end of time. We need to do better for cancer patients on every level. More funding for precision medicine that could allow my spouse to see his children grow up. More financial supports for families so that they do not have to decide if they have enough for gas money to get them to the next treatment at an urban center, while also putting food on the table, and more psychosocial supports so that other families may not have to watch their children struggle as mightily as mine did.
Wow. Wow, very, very impactful. Thank you, folks. I'm going to try to, recap those at the end of this session, but what I'm hearing so far are really real, amazing, and make sense. And I really loved when you say, Tracy, that we need to do better at every level. Thank you. So let's move on to more the next question, which is, going to dwell into impact of cancer on patients and families a little bit more in detail. For example, what are the needs of patients and families when it comes to emotional, social, and financial support? So you folks actually have touched on these a bit, but let's start with Marcelo. Marcelo, did you have anything else to say specifically on impact of cancer or needs? It doesn't have to be your experience again. It may be something you are observing in your community.
Yes, I was gonna just mention that it was already talked about the financial support by Tracy and Jill. And the people live out of province or in remote places, and they need to stay in a place and spend lots of money, and it's a hardship on the family. I think that mainly the mental and emotional support play a crucial role especially at the beginning. And I think in the case of Tracy and her husband, having a long-term journey, that also becomes much more important to have emotional support. I think that receiving a serious diagnosis and this lingers for quite a while, this process lingers for quite a while, makes a toll on the family. And I think that what we need is perhaps more psychologists involved in the precision medicine treatments, because that will help not only the person with the ailment, but also the relatives, the surrounding family. I think that's a approach, because in my case was the diagnosis. I took it as a relief, but it's not always the case. So we had to take on a case-by-case basis, and we need to be positive in order to keep going with this. Otherwise, you can get into a dark space, and nobody wants that.
All right. Thank you, Marcela. Wonderful. Cara, you wanted to talk about psychosocial part now, so I think it's going to add up to what Tracy, Gilles, and Marcela already said, but go ahead, fire away.
Yeah. I mean, I have a little bit more to add. I don't agree with what everybody's saying, of course. And yeah, I think family therapy is really important, like therapy for everybody. And I think what's more important, I mean, I think actually, yes, it's important to have more like practitioners who can offer this sort of thing, because I know that we are lacking there. But I think what's equally important is setting a norm that it is expected that you will need this, because you kind of have to fight for it right now. At least in Nova Scotia, you do. Like it's not necessarily, or it's been my experience, I guess I should say, I can't speak for everybody, but myself and other family members who've had cancer, it's not upfront presented to you as like, here's where you go for your psychosocial treatment. Whereas when I was in Alberta, it was. So that was a difference. I can't say if it's still that way in Alberta, because that was a few years ago now. So that's something that would be really good. I think not only if the resources were there, but also, again, it sets the norm for the patient that like, it's very normal for you to need someone to talk to about this, because there is like a lot of psychological issues that are going to come along with it. And that doesn't necessarily mean a diagnosed psychological disorder, but being in psychological distress is to be expected, like for both you and your family. And a lot of people are not getting the help that they need with that. And yeah, the one size fits all approach, again, is not ideal. It does need to be more personalized. There's going to be different families are going to have different concerns. A lot of my psychological concerns around cancer were surrounding my children, because I had young children as well, and not just psychological, but like resource supports. For example, like I needed childcare sometimes. I needed support to stop breastfeeding because I was nursing my daughter at the time I was diagnosed, and that was not available. Like I asked for it, but like nobody knew what to do. And like, you know, babies don't like it when you have to suddenly take away their main food resource. And that's something that I could have used support with. But again, speaking to the personalized bit, that's not something everybody needs support with, but there's probably just as many like traumatic things that other people are going through that they're not receiving that support. So yeah, that's kind of what I wanted to say about that.
Thank you. Thank you, Cara, and thank you especially for you know, bringing the family back to the table as well. It's not always the family members, especially young children and children, parents, sisters, and so on, are also maybe affected, and they may also need to address their psychological distress. I really like to say, thank you so much. Tracy, fire it away.
I think all I'd like to say is that when my husband was diagnosed, cancer became our family. It wasn't just the person who was diagnosed, it was all of us. We were all in this. And when it came to psychosocial supports, none were ever offered to us and none were ever spoken about. So I had to reach outside and cover therapy for my 2 kids and myself out of pocket myself. It's not part of the current cancer regime in our province. So in order to get them the emotional support to get through this battle and the emotional support to deal with the fact that this is now what we were facing, I had to step outside the box and find it myself, which I did. But not all families may do this because you're so overwhelmed with cancer that you're trying to then reach outside of the cancer box and find additional support. And it's just all in one way. And I don't think it should be that way. I think all these supports should be offered at the time of diagnosis and not have you go out on your own and try to find additional supports.
Yeah, no, absolutely wonderful. So emotional and social and financial support. You also made a great point in the previous round about the financial cost of cancer, because not everything is covered by our private or workplace benefits or even the government benefits and so on. So this may include treatment, this may include out of pocket, like for travel, and so on. So certainly, I think the Canadian Cancer Society estimated on the average at least $33,000 extra dollars loaded on the shoulders of the cancer families because
and I
of
think
this.
rural, it makes a big difference, rural versus urban, because we have to
Right.
travel.
Yeah,
to-
absolutely, Travel. Yeah, no, and Gilles also made a great point. Certainly, geography should not be, negatively affecting how we access things, but unfortunately, it has been so far. But I'm hoping that things will get better over time. There's quite an interest in that, but we should keep pushing for it, advocates and everyone else. Perfect. So let's go to the next question. In Atlantic Canada, there are also opportunities, maybe, because, for example, in my own experience, community is really very community driven here in Newfoundland and Labrador, and I'm assuming in other parts of Atlantic Canada as well. So this is just one example. So what kind of opportunities, if ever, for better days ahead, for better cancer control, whether it's prevention, whether it's early detection or treatment or screening and so on in Canada. Do you see any opportunities that we can utilize, capitalize on to do things better for the next patient, next family? Gilles, sorry, Marcelo, did you have anything to say? It's okay, you can skip questions.
Yeah, I see lots of opportunities. I think that if we're lucky to have this group, the Atlantic Cancer Consortium, the Patient Advisory Committee, and also the Atlantic Cancer Consortium working with the Marathon of Hope or the Cancer Centers Network.
Yes.
I think that's we have basically a good group of people working on precision medicine and control, and probably lots of early detection, I see, but also with the treatments, and I think they are quite well connected across Canada. So I think that's I see lots of opportunities in that. I also see, and this is lived by my own experience and by my conversation with other survivors, that how good our professionals are, our doctors, our nurses, our radiotherapists, our chemotherapists, all the people involved in treatment, and how good they make you feel. Unfortunately, there is not enough of them. Probably we might need more of them, because if the strengths that we have in the system, they are working in such a good way, with such a passion and warmth, and make you feel so comfortable. I think that if we had even more of them, that would be good for them, and therefore we can have a continuous system of support for patients and relatives, and again, including more psychologists or people that work in the psychosocial environment. That'll be great.
Yeah, wonderful. Thank you. Thank you, Marcelo. Amazing points. I really enjoy listening to this. It's always good to hear opportunities happening, and noticing them. Cara, did you have anything else to add to what Marcelo said in terms of opportunities in the Atlantic Canada?
Yeah, I would just reiterate that things like this, that are partnerships between scientists and patients and clinicians, and I mean, everybody really who's involved, but especially getting the patient voices involved, the patient, survivor, family member. I mean that as like an inclusive term to mean anybody personally affected. Yeah, I think that's very important, and I think we've seen some changes with the movement toward that, and I think let's keep it up. So I see that as an opportunity going forward.
Oh, wonderful. Gilles?
Yes, talk a bit about prevention. I think that cancer just happens and has nothing to do with lifestyle, has nothing to do with diet. It just happens. And I think that we need better education, better information, preventing cancers to start with. Early detection. There should be more screening for all types of cancers. Basically, it's left up to often I think, to your family doctor if he's going to get you tested for something or not. Prevention and early detection are key, and frankly, would better prevention, better early detection will help the governments financially, and hopefully those resources could be put back into support for cancer patients. Thank you.
Wonderful. Critical points. Thank you. And thank you for bringing in the governments and how they can benefit from actually preventing and early detecting cancer. We cannot stress this enough, how important that is. And financial cost is one of the things that the healthcare systems and governments certainly prioritize. So hopefully they are listening to us today. Thank you, Gilles. And Tracy, did you have anything to add, my friend?
Yeah, I think for me, the most important thing that I would say would be early detection. Because the most important takeaway from my spouse's story is that all the symptoms were present and over a prolonged period. There was only one problem. We had never heard of the symptoms of bowel cancer, and no physician raised the idea of either at-home FIT testing, which is so easy to do, or by means of colonoscopy. You can order a FIT test online or even on the phone. It'll come straight to your door. You do your sample, you send it back, and you get your results. And you may be able to divert yourself from where we are. I think that's why awareness campaigns and conferences such as this one are so important, because there's lots of my families out there who never knew what to look for. They never knew all the things that were going wrong. They just chalked them up to various, I'm getting old, or I'm getting tired, or I'm getting. So these conferences are vital in awareness of the signs and symptoms and spreading when to get tested and how to get tested. They are also lifelines that keep families like mine moving forward. And I always say to people, if that's not enough to get you moving to look after your own health, just imagine sitting with a 16-year-old and an 8-year-old on a couch while you try to find the words to tell them that their dad has stage 4 cancer. And the tears are already rolling down your cheeks, but you have to try to explain to them. So I think prevention is key. No one wants to have that couch talk.
Yeah. No, wonderful. Yeah, absolutely agree. Absolutely agree. Prevention, early detection, more investment, more awareness, and more screening. And Gilles made an excellent point. We can't screen for all cancers right now, right? We can screen for breast, colon, maybe skin, maybe prostate, cervical cancer, and so on. But for many of the other cancers, we don't have a screening program available yet, hopefully in the future. So we have 17 more minutes before the end of our session. So I want to leave like maybe the last 5 minutes for questions, looking at the chat box and so on. So that means we have time for yet another question, folks. So, you know, you have lived experiences, you have perspectives, you are great advocates. I know each one of you. You advocate for the better conditions for the others. For the next patient in line, future patient, future family. So let's talk about, you know, what would be your best tip or tips for the other patients and families, whether they are currently here and listening to you now, or they will be diagnosed in the future. What would you tell them to, you know, what would be your best tip or advice so that, you know, maybe they can benefit from your tip and have better cancer experiences? Marcelo.
Okay, I'll start again. In my case, I advocated by myself, but what I was thinking is in other areas and other cases in which navigators should be present. So therefore, what my tip would be, try to get in touch with a navigator that can help you and guide you through the process, and in some sort give you some sort of education as well, like we were talking before in the past. That would be for me one of the main tips I would give to the patients, or to the general public in general, when they are confronted by a serious diagnostic of cancer.
Yeah.
That's my take.
That's great. Thank you. patient navigators. Everybody loves patient navigators, and we are going to hear about them in the conference today. Thanks. Cara, did you have anything to say?
Yeah, I'll say, I mean, I feel I have a lot to say, but the one thing I will say too much, the one thing I'll say, which I think is a good tip, or at least it was for me, for patients and families, is to kind of find your cancer social network. So find people that you can talk to that also have cancer, and whether that's the same diagnosis as you or not. I don't think it matters that much. Like I have like some people that I talk to who do have the same diagnosis as me and same, life experience or similar, like have small children as well. But I have others who are like, decades older than me, but different diagnosis, but we still do have like a common experience. And I think that's really important. I think it's really important to have people to talk to about it that are not, your partner, your family, or even like a therapist or counselor, because it's just different to talk to someone who has that common experience, and it's kind of a safe space to bring up things that might be distressing to bring up to your family, or that, a therapist has some like, education in it, but they don't have the same, just the same, I guess, level of empathy as a person who's actually been through it. So again, maybe it's not for everybody, but for me, I found it very helpful. And I think it's, if people think it would be for them, then I think it's a great thing to seek out people who have that common experience.
Thank you. Thank you very much. How about you, Gilles?
I think support from the professional resources are there, but also on the other side, family or friends, starting when you were first diagnosed. I think a lot of people go to their first appointments are so overwhelmed that they walk out of there and don't remember much. Have someone who can be with you, have someone help you navigate through the system. In my case, I was very fortunate because I have in my immediate family two doctors and two scientists. So, and they were a great help, obviously. So I had that resource. A lot of people do not have that. And I think they need, one piece of advice is find someone. If nobody in your immediate family, find a friend, find someone who's been through a similar experience, and get that support, get someone who can help you get through this.
Thank you, Gilles. Right, peer, personal, friend, family, or professional support. Absolutely. Yeah. How about you, Tracy?
I think what I'd say to the next family is you're not alone. Never think you're alone.
Yeah.
In every community or very close by, there's a cancer family. And most of them are like me. They don't mind. They love to share. Even if it's just a chat about how you felt when you were first diagnosed. You don't need to have the same cancer. You just need to be in the world of cancer, I think, sometimes to make that connection. I'd say advocate for yourself and your family. No one knows your family and your needs like you do. So reach out for what you need, whether that's from the healthcare system, from the government, from an outside source, from whatever, but advocate for yourself. And last, I'd like to say, because it's a very personal one for me, whether a patient or a caregiver, look after your mental health as well as your physical health. Because mental health is one of the aspects that's often overlooked when you get a cancer diagnosis, because everything's about the physical, but it's also a key factor that can age a journey prematurely. So you want to look after your mental health, your family's mental health. Everyone needs to be on their game.
Yeah. Thank you. So folks, if I may just briefly recap what we have talked about today. First of all, I want to thank everyone for their insight, sharing their stories, experiences, or perspectives or observations in the community. Seeing and hearing the patient and family and community side is always helpful, we all learn from your words and your stories. So we talk that, you know, cancer is a personal experience. Everybody understands this. So and from one person to other, it can change. That's fine. So we talk about, you know, privacy, when we talk about precision medicine, genetic data, how it's used. These are really great questions. I want to thank Marcelo for bringing this up. So how to protect your own genetic data or any misuse of it. So these are some of the future topics maybe we can talk about as well. Oftentimes, you know, precision medicine is, I think, supported because we all understand one size does not fit everyone. And there are really great progress in this area, not only in terms of treating, but also preventing hereditary cancers, for example. So it's worth talking to your healthcare providers about precision medicine and how to protect yourself, or whether there are ways to protect yourself from developing cancer or getting worse outcomes. Education and increasing awareness comes as an important part of cancer journey, as well as, you know, the opportunity of having a personalized guidance, whether this will include navigating the clinical systems, such as through the patient navigator programs, or emotional, psychological, or social, or other support. So that's also amazing. We talk about the mental and psychosocial support and how it should be actually offered rather than the people, you know, looking for it. So it can become an integral part of the cancer care, hopefully in the near future. We talk about the importance, or, you know, the positive impact of the healthcare providers in Atlantic Canada. Certainly is our observation here in Newfoundland as well, Newfoundland and Labrador as well. Healthcare providers, really dedicated works well, and they make a difference in people's lives. Financial support is important because it's not a secret. Cancer can be a very costly disease. And for some folks, for example, those living in the rural areas, it may be even more costly because it involves travel and other arrangements needed. So we need to be mindful of patient and family needs, and hopefully things will improve over time. We know that there are institutions, researchers, and groups such as the Marathon of Hope, Atlantic Cancer Consortium, Atlantic Institute for Cancer Research, and so on, in the region, trying to make things better for the Atlantic Canadians. It's really nice to see the appreciation of researchers, patients, and scientists working together, such as the Patient Advisory Committee, who's organizing this conference, by the way. So we hope to have better, more efficient, and more integral patient partnerships in cancer research, prevention, early detection, treatment, and so on. So better days ahead, folks. We talk about, you know, prevention and early detection being really critical. I agree with you. There's a lot of emphasis on treatment rather than prevention and early detection, I would say. So hopefully things will turn to that way. Because as you very elegantly mentioned, you know, it's also good for the governments to early detect or prevent the cancers in terms of financial cost. Cancer is a personal experience, but if you need support from your, you know, family, friends, peers, or from professional resources, don't hesitate. You are not alone. As Tracy said, and as Tracy said again, you know, we really need to do better at every level in terms of cancer. So did I miss anything crucial, folks, before I go to the chat box and see whether we have any questions, comments? Oh, good. Okay, so I'll briefly screen. Thank you, folks. This is a very busy chat box. I really appreciate this. Privacy is key. I fully agree. You know, it's really up to you how to share your genetic or other data. You should have the power to decide. Regarding the testing, insurance implications, somebody asked about the insurance implications of genetic data. And Kathleen Buckley, she is actually one of our speakers today, this afternoon. She's going to talk about genetic testing. She has noted about the Genetic Non-Discrimination Act in Canada, which prevents insurance companies from requesters or genetic information, please go through the links she provided. There is support for peer support groups, absolutely, and gene banks and research we've done in terms of precision medicine in Atlantic Canada. Yes, Marathon of Hope, Cancer Centers Network, absolutely critical research is being done. Right, and then there are community support organizations. Some of the links are being also passed it, folks. If you have time, please do. There's one question I do see here. Which challenges do patients face when navigating the healthcare system to obtain personalized cancer treatment? From your perspective or experience, what can help you to navigate the complex health system to care? So I think this is a great question. Would any of you like to address this? Navigating the healthcare system, challenges, how do we? So from our conversation, for example, the patient navigator system or cancer navigator system, we have it in Newfoundland and Labrador, I believe in other Atlantic provinces as well.
Yes.
Yes, right? Yes, perfect. So that would be a great resource to connect. In Newfoundland and Labrador, you don't need a referral, you can self-refer. Connect with the patient navigator system and they can help you with that. Hopefully, wherever you are living, this program is also happening. And we have a talk about this in the afternoon. If you stay, then maybe you can learn more. Hopefully that answers your question.
But I'd like to say that here in Newfoundland, we have a serious shortage of cancer navigators right now. Most of them have a very high caseload. So, like, to even get in touch with your cancer navigator, you may be waiting up to a week to get a call back to get your question answered. So that's something we definitely have to work on.
Yeah.
Because sometimes you can't wait a week for an answer.
Yeah, you're right. And I think I do see some comments in that line as well, aligning with you. So, Cara, maybe we can have you raise your hand.
Yeah, sorry, I have a cold. I'm just coughing. I was gonna say I don't think we have the patient or cancer navigator thing in Nova Scotia. If anybody else is in Nova Scotia, maybe they can speak to it. I know there's like nurse navigators that are specific to like, pardon me, like surgery or chemo, but they're specific to that given area. So yeah, you do kind of have to be your own advocate, which is really difficult. There's a lot of challenges. I'll stop now so I can cough.
That's okay. All right. So there are a number of other questions and comments in the chat box, folks. We don't have time right now. We have to close this session, but please continue to address, continue to chat within yourselves and maybe during the week breaks as well. Now we have to close this wonderful session. Thanks again, Marcelo, Cara, Gilles, Tracy. You guys are amazing. So we will see you around and thanks again. See you next time.
Thank you. Thank you for giving us the opportunity.
Thank you. That was very amazing. Right. So I'll just thank you. So I'll just get ready because I'm the next speaker. In the meantime, Jan, would you like to introduce me or do you want me to do that myself?
No, that's totally fine. I'm more than happy to introduce you. I want to give a special thanks again to